Hello, and welcome to SoCo Chat, a podcast where we discuss all things concerning the County of Sonoma. This is where you'll have a chance to hear directly from leaders within our county government, listen to in-depth discussions about critical issues, and hear a variety of tidbits and tales about this wonderful place we call home. I'm your host, Paul Gullickson, Communications Manager for the County of Sonoma. In today's segment of SoCo Chat, we're going to talk with Sonoma County's new health officer, Dr. Tanya Phares. But before we do, I want to remind you about our weekly trivia question. Be the first to answer today's SoCo Chat question, and you'll receive one of these limited edition SoCo Chat coffee mugs. At the end of today's segment, I'll let you know the trivia question for today, as well as how you can submit your answers. So stay tuned. As I mentioned, our guest today, we're very happy to have Dr. Tanya Phares, Sonoma County's health officer. Dr. Phares is an experienced physician, executive from Reno, Nevada, who has held several leadership roles here in healthcare. She also has roles in healthcare, and we'll find out more about that. She was appointed Sonoma County's health officer in mid-November by the Board of Supervisors. Dr. Phares, welcome to SoCo Chat, and welcome to Sonoma County.
Thank you, Paul.
I don't need to welcome you to Sonoma County. You originally were here in the Northern California, correct?
That's
when you
right.
grew up.
Yeah, I grew up in Northern California, so I'm returning.
But your Northern California is a lot farther north than
I grew up in Humboldt County up on the coast, and so when I was a kid, I actually thought Sonoma was Southern California when I was younger.
I think it's so funny. That's great.
Yeah.
Well, welcome back. So, do you mind telling us a little bit about your background, how you got back here to Northern California?
Sure, yeah. So my background is in public health and internal medicine. I trained in Southern California for a while.
The real Southern California.
Real Southern California, that's right. And then I was up in Reno, Nevada for a while before coming down here to Sonoma.
Okay.
And I've done a lot of work around chronic disease prevention and then health system process improvement in previous work.
Okay, great.
Yeah.
We'll find out more about that. But first, let's find out more on the personal side. What is it that you like about Sonoma County? Are you a foodie? Are you an outdoors person? Do you like the wine, arts? What is it you love most about Sonoma County right now?
Oh my gosh, I like all of those things. I would say that I like that you can do all of those things in the same day. So
Yeah,
you can go out to the beach, you can be hiking, and then you can come back in and take in some art and some really great food in the same afternoon. And it's all accessible. So.
Yeah, well said. I think that you speak for many of us who feel that way. So, well, listen. Let's get into it. I mean, during the COVID pandemic, the role of the health officer was front and center. We had a number of webinars with our previous health officers about giving updates, but we're kind of in the endemic phase now of COVID and less of an emergency. And the health officer is more behind the scenes. Would you mind starting us off by describing what does the health officer do during those non-crisis times?
Yeah, that's a great question. So the health officer role is that, they work to protect and improve the health of the community. And so we do that by monitoring all kinds of data, working on outbreak investigations to control disease in the community, collaborating with partners, hospitals, providers in the community, and then enforcing laws that are in place to protect public health.
And so you're constantly meeting with people out in the community and checking in on what they're experiencing in the community and whatnot.
That's right. Yeah, absolutely.
And do you have an eye toward infectious diseases or are just sort of healthcare outcomes for certain populations within our area, or what are you kind of focused on?
I like all the different components of public health. I really enjoy chronic disease prevention.
Chronic disease, okay.
That's probably my focus, although I've done a lot with infectious disease. I like all of it. I'd say our healthcare processes are very important and how we communicate and have protocols in place so that we can react quickly and efficiently. So that's an interest of mine as well. Yeah.
Well, obviously that was at play during COVID, and we've learned a lot during that time. Now, of course, we're in the middle of cold and flu season right now. Many of us are experiencing that, or our families have. During the winter months, respiratory viruses are at their peak. What's the latest information you can give us about the spread and risks of COVID in our area right now?
Yeah. So right now, COVID, at least hospitalizations have gone down for the
Okay.
past week. So it's dropped about 50%. We were at 39 cases last week. We're down to 20. So it looks like it might be
Oh,
improving.
good.
We have had about 18 deaths this season from
Mm.
COVID complications. And the interesting thing is that we could do better with our vaccination coverage.
Mm.
So right now, about 19% of the population in our community is up to date with their COVID vaccine.
Hmm. And what is your recommendation? Do you really encourage everybody to get the latest COVID? I don't know if you call it a booster, but the latest COVID vaccine, or is that really more targeted for the older, more vulnerable populations?
I would encourage everyone, so
Okay.
6 months and older, should get their updated COVID vaccine or booster.
Okay.
Same with flu.
Okay. Well, let me ask about how we monitor these nowadays, because nobody's, well, I shouldn't say nobody, but so few people are reporting their tests, right? I actually tested myself just this past week. I had a head cold and I tested negative, but so few people actually report those results nowadays. So we don't have much data on that front. So how do we track the spread of COVID or RSV or anything else in our community right now?
Yeah, no, that is such a great question because we're only as good as the data that we
Right.
have,
Yeah.
right? And so we have wastewater surveillance, which is a great way to monitor that.
Wastewater surveillance. Okay.
Yeah, so we monitor that. So for COVID, we've seen that the trends they're actually improving a little bit now. They were
Hmm.
going up December, early January,
Hmm.
coming back down, and we're seeing that across the different viruses.
Yeah, and so this is actually we have people sampling the water in our wastewater streams to see what the
Right.
levels are of COVID or other infectious
Yeah,
diseases.
exactly, across the sewer sheds.
Yeah, it's a very interesting way of keeping track of things, but you find it is reliable source of information.
It's very useful.
Uh-huh.
It gives us some nice trends.
Well, that's great. Well, we've been hearing a lot about this new dominant strain of COVID. I guess JN1, is that what they
Uh-huh.
call it? It it's it we know it's very contagious, but it's not as critical. What's the best way to frame it? It has the negative outcomes that we've seen in past variants.
Yeah, so it is very good at evading our immune system.
Oh,
It
okay.
is very transmissible, but it so far it appears that it's not causing severe disease.
Okay.
And the good news with that is that our tools work. So
Hmm.
we have vaccines that work against it. Our testing detects it. We have medications that are effective against it. So right now, everything is working for us.
Hmm.
And it's an interesting variant because it is the most dominant. It's gone from about 45% of the variants in mid-December up to
Hmm.
upwards of 88% in California and the US for that matter. So
Hmm.
it's an interesting one.
Have we seen, and yet we still, like, as you noted, we had 18 deaths. Are we seeing any commonalities on the people who are these people who have other underlying health conditions they're dealing with that tend to fall victim to it now, the COVID?
Yeah, I mean, you're more at risk if you have underlying medical conditions. I
Yeah.
mean, for a lot of respiratory viruses, I
Yeah.
would say.
Yeah. I think, yeah, we've seen that a lot of them are people who are either in the hospital or senior care facilities, assisted living, whatnot.
Hmm.
So, okay. And so it's interesting, though. We do see fewer symptoms happening in this latest strain of a variant. Um, in fact, the California recently decided to loosen its COVID isolation guidance for patients who test positive for COVID but do not have symptoms. Would you mind talking more about that?
Yeah. So, the thing with COVID is that it's endemic now,
Yeah.
right? So it's here to stay,
Hmm.
but it's not overtaking our healthcare systems
Hmm.
currently.
And not having the
And
negative outcomes we've seen before.
yeah, and so we have vaccines against it, we have medications against it that
Hmm.
work against it, and so the conversation's different now. We're at a different time than
Hmm.
during the pandemic, and so it makes sense to reevaluate the guidance that's out there, and I think it is a good thing to start aligning with. That guidance with the other endemic respiratory viruses
Hmm.
in the community.
So people don't necessarily need to lock themselves in a bedroom for a week or two just because they test positive. If they don't have symptoms, they can still, what's the guidance, I
So
guess?
you still want to take the same
If we
kind
want
of
to protect your
precautions.
family,
Just and these are things that we know to do, and you're going to do it
hmm
for any respiratory illness,
right.
right? So, you want to stay home if you can,
hmm
wear a mask. If
Okay.
you know if you're symptomatic, wash your hands, cover your cough, and we know these things. You want to take those kinds of precautions.
hmm Yeah. And do you still encourage people to test?
Yeah, and there's if you've been exposed, then you can take a test. Yeah.
hmm hmm
Or if you're a high risk.
Yeah. But mainly for your own, your workplace, your family, so that and you can
Right,
protect
right.
them as well.
Yeah. And there's certain environments where um we still ask for masking, like in
hmm
healthcare environments where there's direct patient care.
Okay. Well, that leads my next question about masking. I mean, is it good advice to mask, or are we can we set aside our masks nowadays if we're healthy?
I know we all are tired of the masks.
Yeah, I don't want to be told I need a mask, but I
Right.
understand it at the same time.
Yeah, yeah, I know. I get that. And I think it's something, we have to start addressing these respiratory diseases, as a community and do what we understand is, the right thing to do that's the most effective. And so I
hmm
don't want to be the one that's directing people to do it. I want us to be on the same page that this is a way we mitigate spread in our community. So yeah, masking is very effective. Yeah, if you could stay home, stay home. If you need to go out and you have any respiratory symptoms, we're not just talking about COVID. It could be the
hmm
flu. We've got all these viruses in the community. Yeah, wear a mask so you don't spread it around. That's going to be helpful.
Well, just to be clear, you're not anticipating any specific health orders, issuing any health orders for Sonoma County. We're are we following the guidance of the state's California
Yeah.
Department of Public Health? Is that what we're doing?
Currently, there's no need for any other guidance
Okay.
from us at a local level. So
Yeah.
we are aligned with the state guidance right now.
Yeah. That's often a question we get here in the communications department is, oh, is there going to be another health order coming out? And I assure people, no, I don't see that on the horizon. So
Right.
it's always good to let people know that. Well, tell us about what we know about RSV and flu. I mean, is that still strong in our community right now?
It is, yeah. We got all of these bugs circulating right now. So for influenza, our wastewater surveillance and our testing data were showing that it was going up in December and January, now trending back down.
Okay.
I'll say that it's been a milder season
hmm
than last year for flu, but like COVID, our vaccination rates, we could do better. So we're 32% of the population is up to date with flu vaccine. And
Okay.
and I'll emphasize, vaccine is our best tool against the severe disease from these viruses.
hmm
So it's not too late to get your vaccine for this season. I'd highly recommend getting that.
And I thank you for making that point because I wanted to ask you about that. So even though we're, almost to the end of January, it's not too late to get flu and COVID vaccine or,
hmm
um,
It's not too late. You could still go and get them. Yeah.
yeah.
And RSV for certain groups of people, it's indicated. Yeah. So infants, young infants under 8 months or up to 19 months, if they have, um, uh, high risk. Pregnant women, 32 to 36 weeks should
Yeah.
get it.
Okay.
And then older people, 60 and above should get RSV
RSV.
vaccine. Yeah.
Okay.
And then for flu and COVID, everyone 6 months and older.
Everybody should get that.
hmm
And I know, like, I got my vaccines through my doctor during a checkup, and my wife got one. I think she got the latest COVID at Walgreens or something. We're insured, but what about for uninsured people? Where can they get these vaccines?
Yeah, there's lots of resources. So you're right that you can go to your provider, your medical provider.
hmm
Pharmacies have the vaccines, and then we have community clinics in Sonoma where you can get the vaccine.
Okay.
You can go to the Sonoma County website, and there's a list of clinics where you can go. And
hmm
then also vaccines.gov is a good resource
hmm
to see where you can get the vaccine. And insurance usually covers
Yeah.
vaccine, and then there's free vaccines available at some of the community clinics as well.
Yeah, and I know there's that bridge program that I think Walgreens and CVS are a part of that for uninsured people can go get vaccines there too.
Yeah. And if you have questions about that, you can call them or
Yeah.
call your provider, and they can provide more guidance
Yeah.
on how to access that.
Yeah, great. And thank you for reminding people to go to our website because the health We have a great website for information
We do,
on all
yeah.
those.
Yeah.
Yeah, so that's great. Um, okay, and you talked about vaccinations for all three. That it's not too late. Generally, is that going to be ongoing guidance? Or are you going to kind of is that going to become like flu now, where we just encourage people to get boosters before in the late summer, early fall? What are you thinking looking ahead?
For all of these seasonal respiratory viruses, yeah, in general, it's going to be, a yearly thing. So right now, the guidance that I was mentioning, that's kind of where we stand with it.
Hmm.
But you want to get your vaccines updated, or at least think about it. Come September, October is the ideal time. Um, Thinking ahead for next year.
Yeah, good, good. Wow, but we always like to plan ahead.
Yeah.
So now that you've been in your role for a few months, what are some of the other big health challenges that you see that you hope to tackle or you see coming your way this year?
I think that we need to focus on chronic disease prevention. I
Okay.
think there's work to do there, as well as mental health,
Hmm.
definitely,
Yeah.
and overdose prevention. And then building a strong public health workforce. It's a great field to be in, and we
Hmm.
need to build the workforce.
Yeah. Well, I know you've had some vacancies. I know you have some openings for nurses and things like that, and we're always trying to encourage those that those are great opportunities that exist in our healthcare system. But I know we have a number of vacancies throughout the county, and I appreciate you bringing that up.
Yeah, absolutely.
Yeah, no, that's really great. I'd love to have you back sometime and we can just talk about, mental health, because that obviously is a big issue in our community. And I know that I appreciate you mentioning that. Do you have some initiatives you're thinking about what we might be doing more with the county and or working with community groups?
We're looking into it right now. I don't
Hmm.
have anything offhand, but usually we
Hmm.
start with looking at some of the data, and we get the conversation going. So yeah, it's a work in progress right now, but it
Yeah.
definitely needs to be addressed.
Yeah, well, I appreciate you bringing that up, and I would like to have a whole session on that. So let's put that on the calendar.
That
Well,
sounds
tell us a
great.
little more about yourself. What do you like to do outside of work when you're not working for the county?
I like to get outdoors. I like to go hiking and running, and I love finding new restaurants. So
Hmm.
I've been exploring the area. There's a lot of great food around here.
Are you a runner? Do you like compete in running races or do
I
you?
did when I was younger, not
Uh-huh.
anymore
You're
now.
still
It's just
keeping.
for health. Yeah.
Yeah, yeah. Wait, so tell us if you had a go-to place, if you had a weekend or a week after an afternoon just for yourself, where's a place you go to? Is it a restaurant? Is it a hiking trail or a running trail? What is it where's your go-to place?
I am still exploring
Uh-huh.
around the area, so I've been
Yeah.
trying all kinds of new things. One thing I really like is going out to Bodega Bay.
Oh
I
yeah.
like that drive out there and those
Hmm.
beaches around there. It's a real pretty area.
Yeah. It's fantastic. We forget how beautiful it is up there.
Yeah.
Do you get back up to Humboldt County at all? Do you have family back up in that
I
area?
don't have family up there
Uh-huh.
anymore, but I get up there now and then. Yeah.
Yeah. Well, you come from a great you know the beauty of Northern California and well listen, I we appreciate you being with us today. So thank you very much and we would like to invite you to come back. As we talked about, we can have more updates on COVID and other health issues in our county. So thank you for being here.
Thank you
So
for having me, Paul.
yeah, well, we'd also like to let you know that as a thank you, we'd like to give you one of these SoCo Chat. It'd be the first in the health department to have a SoCo Chat coffee mug. So please take that as our gift, and a thank you. And to our listeners, we'd also like to announce our first winner of our trivia contest, and that is Michael Nielsen, who is our human resources analyst here in our employee and labor relations division at the county. Our question was this: what was the name of the movie that was filmed in the 1990s at the Santa Rosa Junior College in the old Wagon Wheel Inn? And the hint was that it featured Robert Duvall. The movie's name was Phenomenon, a 1996 American romantic fantasy starring John Travolta, Kira Sedgwick, Forrest Whitaker, and yes, Robert Duvall. Michael answered our question correctly, and he will receive one of our mugs. Michael also noted that he, in fact, worked on the movie as it was being filmed here, and I've reached out to him and hope to find out a little bit more about that experience. Meanwhile, we are still looking for a winner to our first trivia question, and I want to remind you the question is this. Sonoma County once had a town that was home to thousands of miners. Today, it is a ghost town, but it once was a small, thriving community with 2 businesses, a gas station and a local watering hole known as Hog's Back Tavern. What was the name of this town and where was it located? And here's a hint. These were not gold miners. They were searching for something else. They were searching for mercury ore. If you know the answer, email it to publicaffairs@sonoma-county.org. That's public affairs, one word, sonoma-county.org. Be sure to include your phone number and hometown so we can let you know that you won. In the meantime, we hope you will join us for our next segment of SoCo Chat. Thank you.
Thank you.